Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about actinomycosis. Actinomycosis is a chronic, long-standing condition that is caused by a bacterium called Actinomyces israelii, and it is characterized by granuloma formation, multiple abscesses, sinus tract formation, and subsequent fibrosis. Granuloma formation is when the cells of the immune system cluster together, and this usually occurs if there is any invading microorganism or any invading germ, and these cells of the immune system surround it, and once they surround it, they form what we call a granuloma. An abscess is collection of pus in a given part of the body. A sinus tract is an abnormal tunnel, a channel that connects the abscess, that is the collection of pus, the pocket of pus, to the skin or the mucous membrane. While fibrosis is formation of scar tissue, and it usually occurs when the body lays down a tissue called collagen. And this usually occurs when there is injury or disease within the body. It is the body's way of healing itself. Actinomycosis commonly affects the face, the neck, the chest, the abdomen, the pelvic region, and sometimes the central nervous system, especially the brain. Under normal circumstances, the Actinomyces israelii, the bacterium that causes actinomycosis, naturally resides on the mucous membrane that lines the oral cavity, the upper respiratory tract, the gastrointestinal tract, and the female genital tract. The mucous membrane, by the way, is just a protective lining of those areas, and the Actinomyces israelii should stay there without going deeper into the tissues. But once it goes deeper into the tissues of those areas, that is when it causes disease, actinomycosis. Actinomyces israelii, the bacterium that causes actinomycosis, can easily get deeper into the tissues of those areas through surgery, through injury to those areas, or through disease in those areas. Under normal circumstances, when the bacterium enters deep into the tissues of the body, it is supposed to be eliminated by the cells of the immune system called the macrophages. By the way, the immune system is the system within our bodies that is responsible for protecting us from invading germs, for example, bacteria. In our context, the Actinomyces israelii. However, when the Actinomyces israelii enters deep into the tissues of the body, it hides from the cells of the immune system, the macrophages. So the macrophages cannot swallow it, they cannot engulf it such that they can kill it. So it is not eliminated. And because it is not eliminated, the infection goes on for a long period of time. That is why actinomycosis is a chronic condition, meaning it is long-standing, it goes on for a long period of time. This is because the Actinomyces israelii hides away from the cells of the immune system, so it is not cleared from the body, and these patients are usually sick for a long period of time, and sometimes they are even misdiagnosed to have cancer. Actinomyces israelii, the bacterium that causes actinomycosis, usually hides away from the cells of the immune system through formation of the sulfur granules. Sulfur granules are tiny yellowish particles, clumps, that are usually made up of some parts of the Actinomyces israelii called the branching filaments and a compound called calcium phosphate. So they form a physical barrier around the Actinomyces israelii, and this prevents the Actinomyces israelii from being engulfed, from being swallowed by the macrophages, the cells of the immune system. So these cells cannot easily eliminate or kill it, so it is not cleared from the body. Because the cells of the immune system, the macrophages, cannot eliminate or kill the Actinomyces israelii because it is hiding away from them, what they do is they form a wall around the sulfur granules, and this prevents the infection from spreading to the rest of the body. Some of these macrophages will join together to form bigger cells called the giant cells, and this will further contribute to the formation of the wall around the sulfur granules where the Actinomyces israelii is hiding. This will prevent the Actinomyces israelii from spreading to other parts of the body. Most cells of the immune system, for example the neutrophils and the lymphocytes, will be recruited in the affected area, and this will further contribute to the wall around the sulfur granules where the Actinomyces israelii is hiding, and this will prevent the spread of the infection to other parts of the body. As these cells of the immune system are recruited in the affected area, they will form a cluster of cells in those areas, and this cluster of cells are called granulomas. The granulomas will present as firm, solid swellings, usually red in color and sometimes purplish, and these are called nodules. So what you have to know is the nodules are the physical manifestation of the underlying granulomas, the cluster of cells. As time goes on, the nodules will be filled with pus, and there will also be formation of an abnormal tunnel that connects the pus-filled nodules to the skin or the mucous membrane, and these abnormal tunnels are called the sinus tracts. Pus will be exuding from these sinus tracts, and it usually contains the yellowish particles, the sulfur granules, where the Actinomyces israelii is hiding. For the health workers, please make sure that you look out for these sulfur granules. Whenever there is a patient that has sinus tract and there is some pus exuding from it, please look out for these sulfur granules because it is a strong indicator of actinomycosis. Other cells, for example the fibroblasts, will be recruited, and this will lay down a tissue called collagen, and this will lead to formation of a scar tissue, a process called fibrosis. So it is the body's way of healing that area. The type of actinomycosis that an individual will end up with is dependent on the part of the body that has been infected by the Actinomyces israelii. The first type of actinomycosis is the cervicofacial actinomycosis, and this usually affects the face, the neck, the mouth, and the jaw. The second type of actinomycosis is the thoracic actinomycosis, and this usually affects the chest or the lungs. The third type of actinomycosis is the pelvic actinomycosis, and this usually affects the pelvis and the organs within the pelvis. For example, the female genital tract. Pelvic actinomycosis is very common in females, especially women that have had intrauterine device insertion, IUDs. The fourth type of actinomycosis is the abdominal actinomycosis, and this usually affects the organs within the abdomen, especially the ileum and the cecum and the liver, although other organs within the abdomen can also be affected, but those three are commonly affected. And finally, the fifth type of actinomycosis is the central nervous system actinomycosis, and this usually affects the brain, and it presents as a single abscess, a single pocket of pus in the brain. The individuals that are commonly affected by actinomycosis include those that have a poor oral hygiene, individuals that have tonsillitis, individuals that have a tooth abscess or a tooth infection, individuals that have had surgeries, especially in the oral cavity, in the upper respiratory tract, in the gastrointestinal tract, and the female genital tract, individuals that have gum diseases, individuals that have foreign bodies on the mucous membrane, for example, tongue piercings, individuals that have sustained injuries to the areas where the Actinomyces israelii naturally resides, for example, the oral cavity, the upper respiratory tract, the gastrointestinal tract, and the female genital tract. Women who have had intrauterine device insertions, IUDs, individuals that have suffered aspiration, that is, food or liquids getting into the lungs, individuals that have diseases of the organs within the abdomen, for example, appendicitis, diverticulitis, and peptic ulcer disease, individuals that have a low immunity for some reason, maybe they have HIV, they have diabetes mellitus, they are on steroids or they are on anti-rejection drugs, maybe they underwent an organ transplantation. The signs and symptoms of actinomycosis include fevers, weight loss. There can also be bumpy areas, nodular areas in the affected area, for example, on the face, the neck, the chest wall. There can also be fluid-filled, bumpy, nodular areas, especially on your neck, your face, in the mouth, especially in the cervicofacial type of actinomycosis. The affected individuals can also experience pain on chewing and tightening of the jaw, especially if the infection is involving the mouth and the jaw. There can also be chest pain, especially if the infection is affecting the chest and the lungs. There can also be abdominal pain and a mass in the abdomen. And this can also be associated with a sinus that is discharging some fluid, especially in the right iliac fossa, especially in the setting of the abdominal actinomycosis. There can also be vaginal bleeding and vaginal discharge, especially in the setting of the pelvic actinomycosis. However, these signs and symptoms might not develop until after years from when the Actinomyces israelii was introduced into the tissues, maybe after surgery, injury, or disease that introduced the bacteria into the tissues. This is because Actinomyces israelii grows very slowly, so the signs and symptoms might take long to present in these patients. The complications of actinomycosis include necrosis, that is tissue death in the affected area. There can also be osteomyelitis, that is bone infection. There can also be brain abscess, especially in the setting of the central nervous system actinomycosis. Brain abscess is collection of pus in the brain. There can also be pyemia. Pyemia is when the bacteria enters into the bloodstream and it can multiply in overwhelmingly large numbers. There can also be organ failure and subsequent death. During the diagnosis of actinomycosis, we employ clinical assessment and laboratory assessment. During clinical assessment, we do history taking and clinical examination. And in the laboratory assessment, we can take off a sample of the discharge from the affected area and we can do gram staining and culture. When it comes to the treatment of actinomycosis, we employ antibiotics, and these are usually given for a long period of time, for example between 6 weeks to 12 weeks. Sometimes it can even be longer than that. The commonest antibiotics that we employ include the penicillins, for example amoxicillin, cloxacillin, flucloxacillin, dicloxacillin. We can also employ the carbapenems, for example the meropenem, imipenem. We can also employ clindamycin. We can also employ the macrolides, for example, the azithromycin, erythromycin. We also do a surgical procedure called debridement. And during debridement, we cut away all the dead tissues in the affected area, and we also drain out the pus in the affected area. And we wash the place nicely with sterile fluids, for example, normal saline and antiseptic agents, for example, povidone iodine or hydrogen peroxide. When it comes to the prevention of actinomycosis, the following can be employed. Because the cervicofacial type of actinomycosis is the commonest type, please make sure that you take care of your dental health. And this can be done by avoiding smoking. Please also brush your teeth every after a meal. Please also do daily flossing of your teeth. And this can be done using floss picks and floss wires. Please also visit your dentist on a regular basis. This can help him or her to identify any dental issues on time so they can be mitigated. Please also take precautions to avoid trauma to your body. And if you have any underlying conditions, for example, appendicitis, diverticulitis, peptic ulcer disease, let this be treated on time. That is what I had for you. Thank you so much for watching and listening. Please share my videos and also subscribe. See you in my next video. Bye.